So a very common thing we hear from new patients coming to our practice is, I don't want any more dental treatment done. I'm confused. I'm not too sure what's going on. But when they say this, it's usually because they've got treatment fatigue. And what that means is they may be going to the dentist every 3, 6, 12 months. They seem to be having the same problems, or maybe the same tooth is being treated. Maybe they had a tooth that was filled, then the tooth broke, then they needed a crown. After the crown, they needed root canal treatment. After the root canal treatment, they got an infection. The tooth was then removed. So a lot of the times they're on this treadmill of constantly having treatment done, and they're actually confused and unsure. And what I say to all patients is that if they ever get in this situation, that they should actually look at a second opinion. And the reason for that is that every dentist, depending on their training and I suppose what they like doing and the work that they're good at, they will treatment plan things differently. At Advanced Dental Artistry, we're very lucky because we have 4 dentists here. So we are always discussing cases so that we get multiple angles on what would be the best thing for the patient. What I say to patients is it's always important to understand the pros and cons and the risks and the benefits of having treatment. And it's this balancing act of the patient then deciding of what treatment is best for them. All treatment is optional. So when a patient is presented with options, they will decide on what's best depending on their past dental history, whether they're anxious about getting treatment done. Like if someone says to you, we could fix this for you, but it's going to take 8 visits over 4 months. This may be very different from if someone said we could fix this in a week. It's a different option, but we could fix it in a week and it would only take 2 visits. I suppose for the patient who's extremely nervous, they may choose option B over option 1, even though option 1 may be considered a more ideal option. The other thing is to remember also family history, genetics, past treatment that's been done before. Maybe they've been influenced by their family and friends. So when we're deciding on treatment options, it's important for the dentist to present all options, but to consider the patient's opinion very, very carefully. And we want to make sure when we're discussing treatment plans with patients is that we listen to the patients very carefully, because what we want to do is make sure that we understand their problems they're having so that the solution we give them is ideal for them. And again, it's very individual, and it's important for patients to always consider that if they're thinking about getting treatment done, is that think of long-term options that will basically solve their problems in the long term. And secondly, they must always have trust and confidence in the dentist to ensure that their long-term treatment is going to be successful.